Hello and welcome to this education session on sleep systems. Today we're going to have a look at what to consider when considering sleep systems and how to easily implement this in your home. Let's have a look at the number of hours an individual with limited mobility spends their day lying in asymmetrical postures or in bed unsupported. For example, after 24 hours in a day and 8,760 hours in a year, there are 3,640 hours or more spent in bed. So why should we consider nighttime positioning? Some of the reasons reported by clients or clients seeking positioning would be restlessness, pain, difficulties with temperature regulation such as excessive sweating, weakness or stiffness preventing independent change of postures, respiratory difficulties, spasms, and difficulties managing pressure-related areas. This is a photo of Miriam. Miriam spends most of her day in bed with a few hours spent in a wheelchair. As you can see, her position in bed is mostly unsupported. A closer look at her trunk helps us look more closely at the asymmetry in her hips, the scoliosis of her spine in lying, the asymmetry of her shoulders, and the deviation of her head to one side. This posture will be transferred into a seating system. With the use of positioning components, we can assist in getting a more midline posture. Next, we'll have a look at the implementation of sleep system components in your bed to achieve better sleep. What are some of the factors we need to consider when thinking about sleep systems? For example, are there medical factors such as the risk of aspiration? This influences whether the head section of the bed needs to be raised or not. Secondly, are the carers motivated to implement the suggestions presented on the day? And how can we factor in easy solutions to enable this to be continued on a daily basis? Thirdly, we need to consider the sleep habits and routines of clients. These habits and routines greatly influence whether we're going to find workable solutions which can be sustained. And lastly, does the bed offer the required features to enable it to work effectively with the sleep system components? What are we working towards? In the event that a client is unable to sustain or maintain a stable posture, frequently we have difficulties with symmetry and alignment. The use of sleep system components help us to achieve symmetry and alignment, helping the client feel balanced. And once balance is achieved, we're able to get a comfortable position to sustain sleep. The next photo is an example of a client who has spent many years without the use of sleep system components. As we can see, there is asymmetry of the spine. There's contact between the lower rib and the upper part of the hip. In addition, we can see that gravity has acted and started to compress the internal structures, which will then have impact on respiration, feeding, and elimination. So what do we mean when we talk about using sleep system components? Let's move on to a practical demonstration of this. What do we mean by the impact of gravity and stiffness on a posture which is unsupported? Let's have a look at our client here. She's lying in an asymmetrical posture, one hip over the other. In this position, the integrity of the hip on this side is compromised. We can see that there's some rotation of the trunk, and this leads to asymmetry in lying, which is transferred to asymmetry in sitting. What we're aiming to do is to get the posture more stable, rotated, level pelvis, and a derotated level trunk, increasing the contact with the surface area of the bed. We're going to have a look at putting in the sleep system components so that we can achieve and maintain this symmetry through the night. What we're going to be using is what's called a W leg cushion, and this is going to help stabilize the pelvis. We're going to lift the limbs up. We're going to get the supports in between the legs, getting the thighs into the channels of the cushion. In this way, we get the pelvis level at the hip bones. We don't have the effects of rotation. We have slight flexion at the hips, slight flexion of the knees with the hamstrings in the lengthened position. Next, we'll work on the trunk. Get the trunk in midline. Given that our client is in midline and is able to maintain this posture, this would be a simple solution for supine lying or lying on your back. Next, we'll have a look at how to support the same individual in side lying. Let's now transition to a sideline posture. What we'll need to do is remove our W leg cushion, like so. To get the client into side lying, we'll use supports or a slide sheet. What we're aiming to do is have the pelvis one above the other, support the trunk along the posterior surface. We're looking to provide support along the length of the trunk. This prevents the client from rotating and having any twisting in the spine at night. Once that is in place and supported, we're able to use an additional component along the anterior surface of the trunk. The purpose of this is to provide support for the upper limb if required. Next, we're going to ensure that bony prominences, such as the bony surfaces between knees and the bony surfaces between ankles, are protected. This creates an abducted position of the hips and enables the user to comfortably transition into sitting in the morning. This creates balance, symmetry, and alignment, and limits any difficulties associated with stiffness or contractures. Please ensure that all safety requirements are taken when implementing sleep system components. For example, ensure that a bed rail is lifted to the required height to prevent the client rolling off the bed. Secondly, ensure that the head section is either lowered or raised and is in keeping with the client's respiratory requirements. The use of a pillow is optional depending on the medical requirements of the client. A pillow, such as the one you're looking at, has an indentation in the middle to allow the user to sink in, permitting reduced movement or shear on the ear. Let's now insert a cushion or pillow for improved neck posture and comfort. The next setup we're going to look at is more suited to individuals who require an increased level of support. What we're looking to do is to create a cocoon-like effect around the individual, providing supports, creating alignment, and hence comfort. As you can see, we have some supports along either side of the trunk, which we're going to insert under. Before we do that though, let's work on the pelvis and stabilize the pelvis. In order to do this, we have two options. We have a supine stabilizer. Alternatively, we can use our W leg cushion once again. Today, we're going to use the W leg cushion. We're going to insert it like so. Again, creating stability at the pelvis with hip flexion, knee flexion, lengthened range of hamstrings. Pelvis is now level. The asymmetry is reduced. Obliquity and rotation is reduced, and we're creating increased surface contact with the mattress. In addition, the use of the W leg cushion reduces increased contact with the tailbone. Any concerns about pressure to this area should be alleviated. If you insert your hand underneath the femurs or underneath the thighs, you will feel that the tailbone is actually free. This does not mean that it's floating on the surface of the mattress. It means that the mild hip flexion which we've achieved has taken the pressure off the tailbone. Next, we'll work on stabilizing the trunk. We do this by inserting our supports under two non-slip surfaces to prevent the supports moving out of position. This creates close contact with the client, allowing the user to lie in a cocoon-like mold or area arms relaxed at the side, increase proprioceptive contact with the body. Once the trunk is aligned, we can ensure that the head is aligned and avoiding drift to either side, avoiding any asymmetry being created in the upper part of the thorax or the trunk. Any concerns relating to temperature regulation or excessive sweating is alleviated by the use of a temperate topper, which wicks away excess sweat, creating difficulties relating to pressure. Thank you for being part of this education session on sleep systems. Should you have any queries regarding concerns or would like to trial any sleep system components, please contact us.